Hi, tonight we're going to do an eye and ear um, video assessment. First, I will do a room scan. And that's where I will put my computer. So good evening, Mr. Montagna. I will ask you a few health history questions about regarding your eye and ear. When was your last doctor's appointment, or last eye doctor appointment?
September of last year.
Okay. Did he prescribe you with any um, eyeglasses? Because I can see you are bringing your eyeglass.
Yes,
What's the grade?
1.5.
1.5. Okay. And
Yeah.
did you experience any eye pain, any eye itching, burning sensation lately?
No,
No. How about your ears? Did you experience any ear aches lately?
no,
How about any hearing loss?
no.
No. Okay, so first I will start the checking the visual acuity of my patient. So if the Snellen chart is there and my patient is here, I will ask my patient to stand 20 feet away from the Snellen chart, and I will ask him to cover his right eye and read the Snellen chart, the line, last line that he can read using his left eye. So the last line was line number 8, and he was able to distinguish or read all the letters from line number 8. So I will document that as 20/20 vision for his left eye, or OS. And I asked him to cover his right eye and read using his left eye, and he was able to distinguish all the letters and read all the letters in line number 8. So that was 20/20 vision for his right eye, or OD. And OU, or both eyes, he was able to distinguish and read all the letters on line number 8. So I will document that as 20/20 vision, and I will proceed with a confrontation test. This is to check what happened. Okay, this is to check, is it still running? Okay, this is to check your peripheral vision, or cranial nerve number 2. So can you just occlude your right eye and tell me when you see my fingers?
Yes,
Oh no, just look at my nose.
yes, yes, yes,
Okay, and then switch.
yes, 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 yes.
Okay, thank you. And then now I will perform the diagnostic positions test, um, checking now the 6 cardinal points of gaze. And I will also conduct the accommodation testing. So just follow the pen light, okay? And can you look at this and follow it? Thank you. And that was checking the cranial nerve number 3, which is the oculomotor, cranial nerve number 4, tracheal nerve, and the cranial nerve number 6, which is the abducens. And when checking the his pupils constrict and converge. Then I will check his iris and pupil. Can you please come closer? So checking his pupil iris, it's greenish brown. The color is greenish brown. Checking now the size and shape. Okay, it's 4 millimeters and the shape is round. And checking now the pupillary light reflex, checking if there's pupillary response. So his pupils are equal, round, reactive to light and accommodation. And I will check now his eyebrows, and then the eyelids and the eyelashes. His eyebrows and eyelids are symmetrical bilaterally. There are no lesions, no redness or swelling. The eyelashes are proportionally or equally distributed along his eyelids, and there are no lesions, no scaliness or dryness, flakes like that, no. Um, Now I will check your conjunctiva and sclera. Can you please look up? Thank you. The conjunctiva should be pink and moist, and the sclera is white. Now I'll check for his ears. I'm checking the size and shape of his ears and the skin condition. And the size is appropriate. It's equal bilaterally. The shape as well are the same. And then the skin condition, I don't see any tenderness, swelling, or any lesions. The color is the same as his face, and the pinna is in the right location. And then I'm also inspecting for any type of cerumen or discharges in his external meatus or auditory canal. And then now I will touch your ears, okay? I will now palpate if there is any lumps, masses, any tenderness. Is it painful when I touch it? This
Painful?
Yeah, do you feel any pain here?
No.
No? Okay. And then now I will check your hearing acuity using a whispered voice test. So I will whisper a word and you can repeat it to me if you can hear it, okay?
Blackboard. Eyeglasses.
Okay, so that was checking his cranial nerve number 8, the vestibulocochlear nerve. And so his cranial nerve number 8 is intact. So that ends my eye and ear assessment. Thank you.